Hi, I'm Katie Swan.
My name is Abby Musick.
And I'm Hannah Olafson.
And welcome to the SNAPFacts podcast.
This podcast will explain the ins and outs of SNAP benefits. While we have researched the many different facets of SNAP, we are not recipients of the program, nor do we have the first-hand knowledge of what it is like to live it.
All of us are social work students at the University of Nebraska, Omaha.
We aim to show that hunger in America is not as polarizing of an issue as most people believe. In fact, the amazing truth of SNAP and hunger in America lies somewhere in the middle.
Are we ready? Okay, cool. Hello, my name is Abby Musick, and welcome to the SNAPFacts podcast. Today I'm with my co-host Amy. Our goal of this podcast is to inform the community about SNAP and all of its different sides. Today's episode is a conversation with a SNAP expert on topics like the SNAP meal gap, college student hunger, and the future of SNAP. Our guest today is Dr. Craig Gunderson from the University of Illinois. Doctor, thank you so much for joining us today. Can you tell us a little bit about yourself?
I've been here since 2008. Part of that, I was at Iowa State for 5 years. And then before that, I was at U.S. Department of Agriculture for 7 years in D.C. at the Economic Research Service. And I do a lot of work with Feeding America, which is the umbrella organization for all food banks in the United States.
Can you tell us a little bit about Feeding America and how does it work that one organization gets food to food pantries all over the country?
So Feeding America is the umbrella organization for all all member food banks, which constitutes roughly almost all food banks in the United States. And so what Feeding America does, they provide assistance and guidance to food banks all across the country. And the goal for these food banks is to provide food assistance for those who are vulnerable.
So Amy, we'll start off with our first question about the future of SNAP.
Okay, so as a result of this pandemic, SNAP has been more accessible than ever, with applicants being available to apply online and participant benefits being increased, but the future is uncertain. So how has the pandemic shined a light on hunger and food insecurity?
Okay, so whenever I've been talked to about issues of COVID-19 it's good that COVID-19 is placing a limelight on some of the challenges facing vulnerable households in our country, that they're oftentimes ignored by society. So I'm glad that this shines a light on them. The reason I mention this is, even before COVID-19, 1 in 8 Americans is food insecure. So this was already a serious problem, and everything. Now, I'm a huge fan of SNAP. I think it's, not all government programs are successful, but SNAP really has demonstrated itself to be an enormously successful program. Huge fan of the program. And the way SNAP becomes such a good program is for a number of different reasons. But one reason that I'll concentrate on today is that in general, if somebody's in need, it's more straightforward to get on SNAP than it is to get on a lot of other programs. So it can provide more immediate assistance to people when they're in need, at times of need, like they do right now. And so I'm really glad to see that they're having expedited enrollment for SNAP. One other thing that I'm also excited about is that, I'm not sure if you saw this, but today is the Trump administration is going to bump everybody's benefits up to the maximum level. This is huge. It's just incredible that it was bumped up to that, and that's going to help a lot. So I think that, during this pandemic, it makes Americans aware of how important safety net programs like SNAP are, and B is, there's been this increase in maximum benefit to everybody getting the maximum benefit, which is just amazing. So, even though I'm praising the Trump administration because they've done a great job with, increasing the SNAP benefit, but over other dimensions, they've been less good, like prior to COVID-19, as they were going to take away states' ability to set higher thresholds for gross income and some other and assets. So I was critical of the Trump administration over those dimensions, but I am pleased to see that they're endorsing this move towards the maximum SNAP benefits for all recipients. Mm-hmm. Having more people enroll people is a good thing because that speeds up the process, but more so just making the process easier. I would really like to make the whole process that people get on SNAP, to be as automatic as, when people get onto Social Security or something. I really would like to see that made a lot easier.
Mm-hmm. You talked about the new standards that we've had in response to COVID-19. What kind of impact would it have if those standards remained after the pandemic is over?
in general, I'm not in favor of everybody getting, I think everybody should get higher benefits, but I'm not in favor of getting everybody getting the maximum for the following reason. There's a lot of assistance programs that discourage people from working, okay? There's some assistance programs, if you made $1 over the threshold, you lose all your benefits. That's sometimes the case with health insurance programs, like if you Medicaid. Make $1 more, you lose all your benefits, which discourages people from working. So one nice thing about SNAP is as people's incomes increase, their benefit levels fall. So that's why after COVID-19 ends, I think we should go back to the old system whereby for each additional dollar you earn, you lose 24 cents in benefit. So I'd like the maximum to be increased, okay? But I'd like to still have this feature as people make more income, is that the benefit levels fall.
Okay. So we'll move on to Map the Meal Gap. As mentioned earlier, you're a lead researcher for Feeding America's Map the Meal Gap. What is the meal gap and why is it important?
So we constructed this modeling exercise so we could ascertain food insecurity rates at the county level. So on an annual basis since, I guess, 2010, 2011, is we've been publishing these. And I will be publishing them in a couple of weeks. Actually, what we're going to be publishing them along with the rates that they were established in 2018, we're also going to put out some projections about what might happen due to COVID, to food insecurity rates. So we designed this method for Map the Meal Gap to do this. And that gives us the food insecurity rates. The other question is what's the relative level of need? And the way we did this is there's a nice question on what's called the Current Population Survey, which is what's the official food insecurity rates are gotten from. There's a question on there that's great. It asks individuals, how much more money would you need to be food secure? Which I just think is a really neat thing. Instead of asking experts, about how much money they think people would need or something, you're actually asking people who are experiencing food insecurity how much more income they would need. So we use that question as a way of measuring the level of need of food insecure persons. We do some different calculations with respect to this about how long it happens, things like this. We then divide that amount by the cost of a meal, and from that is then we get the number of meals that an individual needs and multiply by the number of food insecure people. So that's how we get at this measure of the meal gap in this context. In each county, for those of you who've seen Feeding America's website, if you just Google Map the Meal Gap, it comes up and you can figure out what the food insecurity rate is in whatever county that you live in is.
So what do you think is the biggest finding in the project?
I think probably the most important thing that this has shown is that there's enormous variation across the United States in terms of food insecurity rates. Classic examples, if you actually look at that map of the United States to look at North Dakota, and overall the rates in North Dakota are really low, but there's these three counties with much higher rates of food insecurity. Well, those are American Indian reservations. And so it really allows us to see some of this geographic variation that's not gotten if you just use state or national level estimates.
Okay. I have one more last topic to talk about. All of our group members are college students, and we were really surprised to find out how difficult it is to apply for SNAP as a student. Is college student hunger a problem?
Okay, I'm going to say something that's controversial, but I've said this before, so here's, food insecurity exists on college campuses. I'm not denying that it doesn't exist. It exists. A lot of the statements out there that 60% of college students are suffering from food insecurity and things like that just is not true. I've done work on this topic, and what you see is that if you compare food insecurity rates amongst college students to non-college students of the same age, those non-college students have much higher rates of food insecurity. So when I think about talking about issues of pertaining to college hunger, what I like to instead say, yes, college hunger is an issue, but it's even more of a problem for those who are not in college of the same age. Okay, just wanted to say that, and I know it's controversial to say. But I also think that we should make SNAP much easier for college students to get onto. Part of the challenge is that one of the rules on SNAP is that persons have to be working a certain number of hours per week. under these quote-unquote work requirements, which I really hope are waived. But at any rate, is from the standpoint that makes it harder because most people, I mean, a lot of college students do work 20 hours or more a week, but a lot don't. And from my perspective, like I tell my kids and I tell my students is, college is a job. And you're working it full-time at a job doing studying, and that should be recognized as such. So I would like SNAP rules to be modified such that college can be counted as work and get more people on the program. So I think that if I had to do anything to address the issues pertaining to food insecurity amongst college students, the most important thing we can do is to ease the rules in terms of making college students easier to get onto the program.
Okay. And to wrap up, our podcast likes to say that the truth often lies in the middle in regard to SNAP. What are some myths regarding SNAP and hunger from the right and or the left that you would like to let us know about?
Okay, so let's start. Yeah, the myths come from both sides. So let me talk about one of the common myths from the right. I think there's two main ones that come up. The first is that SNAP is a program rife with fraud. Okay, that a lot of people are on the program fraudulently, and that people use their benefits in a fraudulent manner. That's just really not the case. Is that, I mean, the way SNAP, you're all familiar with how SNAP works with an EBT card, is that, it's hard to, if I wanted to sell my SNAP benefits to somebody else, then I would have to give them the card, have to give them my PIN number, and then I'd have to trust that they would bring it back to me. That's relatively rare. Professor Howell and myself, is back in the olden days, is there was actually coupons that you'd have that were relatively not easy to sell, but it was illegal. But in other words, that's type of fraud. The other thing is that you sometimes will have food stores that will say, okay, pretend like you're buying $100 worth of food, and I'll give you $50 in cash. Problem is that, there's not many food stores that accept SNAP that's going to be a possibility. I mean, Walmart's not going to do this, or I don't know, it's a big one in Omaha, Hy-Vee. They're not going to do that. So in other words, that really is an issue. That thing is if you look at error rates, in other words, people getting benefits when they shouldn't be, or the amount that they're getting, that's, roughly, 3 to 5% of total benefits, which compared to like taxes or something, where you get huge amounts of underpayments. I mean, it's a model. And so instead of people criticizing SNAP for these fraud, I'm like, it's actually the model that should be used for the IRS and for other groups. The other common criticism from the right is that SNAP reduces people's incentive to work. And as I always say about this is that that is true of some welfare programs. And I think it's a problem. I think it's a problem that we have welfare programs that discourage people from working. But that's not the case with SNAP, is that for each additional dollar you make, you lose 24 cents in benefits. And so therefore there's a tax on it, but it's not that much. And so the way I put it is, yes, there's lots of lazy people on SNAP. There's also a lot of lazy people not on SNAP, like college professors and stuff. And so in other words, there's lots of lazy people, but there's nothing about SNAP that makes people lazy, or the lack of SNAP that makes people. In other words, SNAP doesn't discourage people from working at all. So I think that's the second myth from the right that I tried to go with. A myth that comes from the left, and this is a particular segment of the left. What school are you guys in?
Oh, the School of Social Work.
School of Social Work. Okay. So that's good. So I don't know if I can then make my claim as a public health. A lot of people who are public health people don't like SNAP because one of the things about SNAP that I love about SNAP is it gives recipients the dignity and the autonomy to make their own food choices. Okay? But a lot of public health people, they really actively dislike SNAP because it gives people this dignity and autonomy to make their own choices. They would rather say to SNAP recipients, you can only purchase X, Y, and Z, and we will tell you what you can and can't purchase. So and the public health people tend to be on the left. That would be the criticism that oftentimes comes from the left on this. SNAP recipients don't eat particularly well, but then again, the whole country doesn't eat particularly well. So in other words, it's like they're no different than any other group that's spending money. The reason why people like to go on SNAP is because they have the freedom to make their own choices. is there's lots of other programs that don't give people that choice, and a lot of people aren't on it. And so if you start to restrict what people do is, you're basically saying, we think these people are so irresponsible, we can't let them make their own choices. And so it's stigmatizing, so it makes people less likely. Quintessential example is WIC. I don't mean to bash WIC, but I will. Is that with respect to WIC, they say you can only have this or this or this for your children. But what ends up happening then is for amongst 4-year-olds, the participation rate is about 15%. Okay, that's really, really low. Amongst eligible households that's about 15% of eligible children who are 4 participate in WIC. Out of eligible children who are 4, approximately 95% participate in SNAP. SNAP is much more popular because the parents like SNAP because they can say, this is what the kids, this is what they enjoy. This is what I think is appropriate for our family. The reason I mention all this is that SNAP is an extraordinarily successful program. If you start stigmatizing recipients, they'll be less likely to be on the program.
Okay. So Dr. Gunderson, thank you so much for joining with us today.
Well, thank you. This is a lot of fun. And I'm really glad you all are interested in SNAP because as I hope I made clear, I love SNAP. And so I really hope that, that this was useful to all of you. And then if you have any further questions, don't hesitate to contact me. I'll try to respond as quickly as possible.
You've been listening to SNAPFacts. While this podcast features students from the University of Nebraska, Omaha, it does not reflect the values or opinions of the university. Our theme music comes from Culture House. That's culture with an X, and you can find them on Instagram. This podcast is produced by Let's Make Stuff Productions, and you can find them at letsmakestuff.productions. We owe a big thanks to all of our contributors for sharing their expertise with us. This show would not have been possible without you. Thank you.